introduce our head, the head of the Department of Integrative Medicine and Professor of Psychiatry, Dr. Shivrama Varampalli. And with me are the faculties of the department. So I over to Shivram sir for the welcome address.
Thanks, Hemant. So this is a interesting exercise for us over the last 6 months. Of course, the pioneer was Dr. H.R. Nagendra, and myself and Dr. Pratima had been there to SVASA for the inauguration in April, isn't it? And it was a very interesting mix of people who are interested in integrative medicine from all over the spectrum, many universities across India. And I should credit my teachers, Dr. Gangadhar, Dr. HRN and Nagaratna Didi from SVASA for getting this together. And this is one of the things that we have done in collaboration. We have had a MOU with the SVASA University for a very long time now. And I'm happy that this has led to this kind of a certificate course in integrative medicine. And so we have all been students and teachers as part of this course, because some of the so-called students in this course have been very, very senior people, like Dr. Shantaram Yudati, who has his own set of experiences which he has shared with us. So I'm very happy that we have been able to complete this course, and 90% of the participants have actually successfully completed the requirements to be awarded the certificate. So it's a proud moment for the Department of Integrative Medicine. As you are all aware, the department actually completed 3 years on October 30th, 2022. So the foundation day of the department, just the third foundation day was there. And we have been lucky to have the full support of the NIMANS administration. And we have managed to start quite a few courses which were on the agenda, starting with the MSc Yoga Therapy, postdoctoral fellowships, and the PhD in Integrative Medicine. And finally, this year, we were able to start the MD Manasaroga in Ayurveda. So this is something that the department can be proud of, and very, very thankful to SVASA and our own administration, Dr. Pratima, Dr. Gangadhar, who have been the pillars on which this whole edifice has been built. I welcome all of you to this valedictory function. I hope all of you have enjoyed this journey of learning and continue to learn as you, the world inevitably is moving towards integrative medicine. At least in mental health and neurosciences, the signs are very clear now that we cannot rely on a single system of medicine. So this has been a good beginning. I hope it goes on to greater achievements. Again, welcome all of you. Thank you.
So now next, we will just give a very brief report of the certificate course. So I request Chandru to put up my slides. This certificate course was a 6-month course that was organized by the Department of Integrative Medicine, NIMHANS and SVASA University together. Next. The National Education Policy 2020 says that given the pluralistic choices in healthcare, there is a demand, from the patients who inevitably expose themselves to different systems of medicine in a country like India. And therefore, it is important that, the modern medicine physician should be aware of the Ayush system and vice versa. Next. So therefore, with the vision and mission, from Guruji, we adopted this particular program, and the aim was to synergize the modern medicine with Ayush system, and the mission was to promote, train, and carry out, some small case studies or research projects in this domain. Next. So this was the objective of the course, that the core concept and philosophy of integration should be conveyed to the medical professionals who belong to modern medicine system, as well as the Ayush systems, and the diagnostic method and the current scientific evidence should be discussed, not only in treating diseases, but also in prevention. Next. So the eligibility for this course was, any student who is in final year or doing internship or later on, who belongs to the medical professional from MBBS background or Ayush background. The duration was 6 months. The course had 22 credits and involved hybrid mode of learning. There were weekend classes online, and there were 2 weeks of field training in SVASA as well as NIMHANS. And this involved 300 hours of total learning. Next. So these were the departments that mainly the NIMHANS focused on the neurology and the psychiatry aspect, and the SVASA had different departments where students were exposed during their field training. Next. Now these are some statistics. We had 20 students who enrolled for the course, and considering the attendance criteria of 80%, 2 students could not fulfill that. And finally, we have 18 students, 9 belong to the BNYS category, 9 MBBS and 2 BAMS students. Next. So surprisingly, we found that 2 categories dominated here. One were very senior faculties who were interested in integrative medicine, and other were very junior students who have just passed their MBBS degree. Or so in between, people are more busy, but these 2 extremes, they both were interested. Next. So we did a small survey yesterday, and students responded. So out of 18, we asked how useful was the program in enhancing your clinical skill. So we can see that more than 90% have given 8 or above. Next. How confident are you at present in applying the clinical skills that you learned in this program? So here also we see that on an average, it is 70%. Next. Do you feel that integrative medicine should be encouraged, in all medical colleges in India? So more than 100% people say that that more than 8 score is there, that it should be integrated. Next. Now we also inquired about what are the major barriers, that hinder or likely to hinder the integration of medicine in your clinical practice. So 33% students says that there are lack of hospitals and resources that allow integration. The experts who can teach them in this domain are few, and there are need for more systematic practical training, which is lacking. The acceptance from colleagues and seniors was another hindrance. Lack of awareness about integrative medicine among patients and caregivers. Lack of systematic assessment tools that can give a systematic plan of when to give which system of medicine, and medico-legal worries. Next. So students were, very enthusiastic, and they participated very nicely. They interacted. So this canvas, gives their feedbacks. So I'm happy to share that most of the students have given a very encouraging feedback. Next. And there are senior faculties, psychiatrists who have enrolled in this course, and they have given their positive feedback. Next. So overall, when we look at the feedback and suggestions, most of the students said that we had 2 weeks of overall field training. They said that in each institute, they would want to spend 2 weeks in the next class. They wanted more inclusion of CBT and other psychotherapeutic techniques also as a part of integration. In SVASA, there were more practical training, but they expected that there will be some theory classes also along with practical training that will, make them involved better. We have published a textbook on yoga for mental health and neurosciences, and students now have requested that in Ayurveda also similar textbooks should be written so that they can understand and grasp the concept of Ayurveda better. And there should be chapters on drug interactions, contraindication of each system, and when to refer a particular system. So these chapters were not included in our yoga textbook, so we can add in the next edition of our book. And many of the students said that if given a chance, they would like to, enroll on a MD program in such a system. Next. So almost 100% of them given 8 or above score that they would recommend it to their friends or colleagues. Next. So we acknowledge SVASA University, Ministry of Ayush, Morarji Desai Institute of Yoga and Art of Living, which were the supporters when the department was in the initial stages. It was a center. We are very grateful to the Director Madam, Professor D. Nagaraja, Dr. B. N. Gangadhar, our HOD and the whole team here, and various department of NIMHANS who collaborated with us. And we invited speakers from different Ayush systems who gave their talk. So we are grateful to them. Next. So finally, this is the whole team effort, not only from NIMHANS, but from SVASA. And therefore, I am really thankful to everyone. Now, I request our Director Madam to kindly give the presidential address to the students and the faculties here.
Good evening, everyone. Jai Guruji. Dr. H.R. Nagendra, Madam Nagaratna is not here, Dr. Gangadhar, my colleagues from the Department of Integrative Medicine, and all the successful participants of this course. Can't believe that 6 months has flown by so quickly. It was almost just yesterday that we were at SVYASA for this particular inauguration. And, to think that you have finished all your theory, 300 hours, practical experience at both the places, and your feedback about the course was also something very heartening. So we know that in the National Health Policy, there has been a focus on interdisciplinary learning and a crosstalk between medical professionals from different streams of medicine. And it's in line with this that this particular course was envisaged in collaboration between SVYASA and NIMHANS. Now, I think Shivrama alluded to this earlier, that the reason for actually learning about different kinds of approaches to treatment is that one treatment does not seem to really give a person complete benefit. We also know that non-pharmacological lifestyle advice is very critical, and they can come from different kinds of philosophies, different kinds of approaches, and involve different kinds of activities. And therefore, considering that there has been a comfort, and this is not just only in India. I mean, I think looking at other systems, indigenous systems, is something that in some ways all countries have done. And I remember that, even leading journals around about the 1990s said that they need to look at other, practices of medicine in addition to just an Western allopathic approach to medicine. So I think that is why it becomes very important to look at care in a holistic and an integrated manner. It's very exciting to see that 20 doctors from different systems of medicine had enrolled in this course, of whom 18 became eligible. And I hope I can see that most of you here are there present today. And it's heartening again that 33% were in the very young age group and an equal percentage were in the older age group. So I think it's been fantastic learning from each other, both from the teams from SVYASA and NIMHANS, as well as from the other participants in this course. I'm sure a lot of experiential learning has also occurred. We heard about the 22 credits that you had undertaken, both the online and the field training that you underwent. And I understand you also presented a case each where you demonstrated how, various things that you learned could be integrated into clinical practice. Congratulations to the organizing team, because I understand this is the first such formal course in the country in the area of integrative medicine. And congratulations to the first batch of students. So in some ways, while the organization has created some kind of a first, you have also created a first in terms of becoming the first participants who have graduated this course. Of course, SVYASA has a long and very, very successful history of working in this area for more than 4 decades now. So I want to compliment SVYASA on this particular course, in addition to all its other accomplishments. And of course, NIMHANS too has more than a 50-year history with when Professor Deshiraju first started the project Consciousness. Of course, even before that, before that, in the 1930s and the 1940s, Dr. Govind Swami, the first director of the All India Institute of Mental Health, had always focused on a holistic approach to mental health and well-being. So I think it is only logical that this train of thought continues to this very day. And of course, various collaborations with SVYASA, the Moraji Desai Institute of Yoga, along with the Department of Psychiatry, has allowed this to be taken up. I want to also thank Professor Gangadhar, who's here with us online today, because he has actually guided this whole, the development of this whole initiative as well as this course. And he continues to have a very, very lasting and passionate interest in developing this area. And of course, an interesting discussion had taken place earlier between the senior faculty at the launch of the course in April 2022. And after a lot of brainstorming, the various facets of training were actually developed. So I think those of the participants who are seeing the completed agenda or timetable or syllabus for your course, this is a result of a lot of deliberation, but it doesn't stop there. What would be very interesting is that your feedback into how else we could make this course more useful to you in terms of your own future ability to practice such integration is very critical. And there, I noticed that some of you, while your knowledge had improved a lot, the confidence that you have, that there was a bit of a spread in terms of the confidence, small numbers, but nevertheless, I think that's very important. So it's very important to try and see how we can enhance your confidence. Very often, confidence improves with regular practice. So I think the team from Integrated Medicine should make sure that they keep in touch with this small yet very important ambassadors of your training program so that you can improve. What will be very nice in the next 6 months or 1 year is to see this confidence in their ability to practice this becomes more and more in the days to come. I'm sure it will be also nice to see whether this is more among the younger participants of the course who may not have had the practical knowledge to take them forth, and then see how best you can improve this. So I hope that this course has given you a good basic orientation to all the Ayush systems, primarily on yoga and Ayurveda, and along with the biomedicine. And I'm sure all the participants of the course will invariably be able to integrate some of the elements of what you have learned in the last few months and what you have gained in terms of helping. Finally, the reason we do all of this is that we believe we can help patients better. And that is the aim of all medicine, to make patients in better health and experience a greater sense of well-being. I congratulate all of you once again. I congratulate SVIASA and our team at NIMHANS. And I wish all the participants a great future, both professionally as well as personally. Thank you very much.
Thank you very much, madam. And thank you so much for guiding us, supporting us all through this journey. And in the launch program also, madam gave very valuable insights so that we could plan this course properly. Thank you once again. Now I request Professor B.N. Gangadhar to kindly guide the students.
Thank you, Hemant. Thank you very much. I heard Dr. Pratima Murthy's encouraging words on campaigning for this program, supporting the entire team. Thank you, Dr. Pratima, for being with this. I also must thank, and also with pranams, Dr. Nagendra ji and Dr. Didi, who actually, I must admit, made me to look at yoga in a scientific way. And that's how the whole program of integrative medicine at NIMHANS unfolded. And I'm sure all of you will realize the foundation into clinical applications of yoga, and of course now Ayurveda as integrative medicine. And that has been possible because of the directions that we got from Dr. Nagendra ji and the SVIASA team in particular. So with these few words of introduction, let me at the outset congratulate each of these students in quote. Most of you are not students any longer, were never the students in the last few years. You have been practitioners of one of the medicines. So you be addressed as trainees rather than students. You were trained into integrative medicine, at least were introduced to integrative medicine, and your participation made the program successful. And you also deserve congratulations for having gotten a chance to go through this program. And more importantly, you are the founders of this program in a way. So you are the first batch who got this exposure, and maybe I will recommend and Dr. Hemant and the team or the SVSR team to consider inviting one or two of you periodically to subsequent courses, not so much as trainees or as people who are resource persons, but people who will perhaps give inputs into how things are shaping your experiences as a group to the forthcoming trainees, so that the your participation into this activity can be considered by the team which is conducting these courses. Integrative medicine has come to stay. It's going to be used more and more, and I'm sure it is going to evolve as the foundation subject for all clinical medicine over the course of time. I cannot at this point of time say how fast it will happen, but it is already happening. I can see that happening in different parts of the world, and also in our own country. There has been views that have been expressed that integrative medicine should be the foundation course. But nonetheless, there have been several other reservations. Leave that issue apart. But the national education policy emphasizes the need for interdisciplinary working together for the best benefit the society should receive from such training and such human resource development. And integrative medicine is going to be one such. So in NIMHANS, as was said, yoga and Ayurveda have come together for mental health and neurosciences development. Elsewhere, we have had an expertise from SVSA integrating Ayurveda and yoga together in the Arogya Dhamma for clinical applications, and also, of course, human resource building. So with these few words, I wish you all the best. I must admit that I must appreciate that your feedback has been very encouraging and positive. That makes us to get this thing remolded based on some of the suggestions that you have given, some of the barriers or other issues that you have pointed out, to make this program more effective, more appealing, and also help attract more and more trainees into this program. Once again, pranams to Guruji, Dr. Nagendra, Dr. Nagaratna Didi, and also my best wishes to Dr. Pratima, the director of NIMHANS, and also the entire team at Integrative Medicine. Thank you for letting me in for this valedictory program. Thank you very much.
Thank you very much, sir, for always guiding us, supporting us. And now also whatever suggestions you have given, definitely we are going to incorporate that. Now I request Guruji, Dr. H.R. Nagendra ji, to please show us the way forward.
My dear brothers and sisters, I'm really very delighted that the first program that we organized with NIMHANS and SVSA has come to a fruition, and particularly I congratulate Dr. Hemant and the whole team of Shivramji for organizing it so effectively. And we should place on record our grateful gratitude to Pratima ji for her continual encouragement, and NIMHANS having accepted to take up this new venture. Though Gangadhar had given a kickoff to integrative medicine, the continuation is being done by the present Pratima ji, which is very laudable. I think this will pave way for further growth of integrative medicine, not only in NIMHANS, but in various All India Institutes of Medical Sciences, where they're empowered to start this IM because they're all INI. And that is the dream that we have. And last time when I met Gangadhar in Delhi, we were thinking that if AIMS Delhi can also start off this program, then it would be great. Therefore, I will be talking to the new director, Dr. Srinivas, who has been very close to me, just like Gangadhar and just like Pratimaji. He has been very close for many years. And he has assured that, yes, we are going to take up this thing. And soon, Hemant and our Vanapari, everybody can start working on this coordination to start off in AIMS Delhi. If it comes in AIMS Delhi, it will spread all through in all the AIMS also. So this is the thing way forward for us in this. And I really was very happy to see Hemant analyzing the whole data in such a crisp manner to present the views of different people through the feedback, which is very, very essential for any program or course that we run. Therefore, I congratulate Hemantji and the whole team for analyzing the feedback from the participants, which is very vital. And that's one important thing that came up with the drug interaction thing. And on that, if we can collect whatever papers that have been published, we can probably add on these dimensions, because this is one of the crucial points which always takes people away from Ayurveda with allopathy, and similarly, Ayurveda people doesn't want to accept other things. They think there is an opposite effect of the two drug interactions. But in our experience with Dr. Nagaratna and Amit and others, we have been seeing that if you intelligently manage, the two things can be effectively handled very nicely. And that needs much more research in this direction. And that could be the one line of research that we can take up to see that we bring them together. And all of you know that the Niti Aayog had a large number of meetings in which several dimensions of integrative medicine had been presented, and a huge document has been prepared by Vinod Pal as the chairman of the Niti Aayog, in which we all contributed. Our Gangadhar also made beautiful presentations, and we all made presentations, and Ayush Ministry, Rajesh Kotechaji and Geeta Krishnan from WHO, they all have essentially brought out this entire document that has been submitted. Now, we have to see that it gets approved or takes the next step for approval from the higher officials. And that's what I was requesting Gangadhar in Delhi, that we should take up this thing further, and maybe we can talk to Vinod Pal and see how best it can be taken forward. And this is the way forward for us. I'm sure the next course we are going to start soon, and we will have more number possibly for this thing. And also a course can come up in AIMS Delhi. And these are some of the thoughts that came to me. And once again, I congratulate all the participants, the 20 doctors who took this with zeal, dedication, effectiveness, and without dropping. This is very necessary. Many times when we take enthusiastically, we take, but sometimes we just drop. So since you have continued and completed the course, I congratulate all of you for having completed the course, my dear doctors of both MBBS and also Ayurveda and Naturopathy. I'm sure this dedication and continuation will continue, and all of you will start practicing and give your input continuously. This is very important. And when you get problems, please refer to us, and Dr. Nagaratna, Hemant, all of us will be there to support you. And if you don't practice, then it will be only remaining in theory or practice which you have learned here. But we want all of you, since you are all practicing the naturopathy or Ayurveda or the MBBS things you are doing, you all should continue to practice integrative medicine and see the role of the different systems to do that. As some of us have been thinking, the first line could be only yoga. And then probably if it is very mild, we may continue with simple Ayurvedic pharmacological interventions and non-pharmacological things like Panchakarma and others. But when it comes to acute cases, we have to use allopathy. So without prejudice to any of these things, we should do. So with this in mind, our Sushita College, we started one course on Ayurveda, a 6-month program called Ayurveda Lifestyle Medicine course. And there's a big demand for this thing to understand Ayurveda and principles, and particularly from TCS, Tata Consultancy Services. Nearly 400 people joined this program, and they were all very happy that it should continue more and more. Maybe some of the dimensions that have been put forth in this thing can be added effectively and see that it comes. And whether we can also start now the diploma program for integrative medicine is the next step. One is continuation of the same program, and then diploma, which we had thought of that 1 year, can we start off the second step. With this, once again, I'm very happy and delighted that the program came to a very nice end with beautiful feedback. Dhanyavad, namaskar.
Thank you, Guruji. Thank you for encouraging us and showing us the way forward. So now, before we proceed further, I request Chandru to take a screenshot for our magazine Samatvam. I request all the participants, to show their beautiful smile. So we'll just take a screenshot. Please put your camera on, everybody. Yes, done. So now I request, students to just give their feedback. Probably we can take students from both the spectrum, someone who has recently passed out and a senior faculty. So anyone who is interested to give feedback.
I'm Dr. Yudadi.
Yes, sir, please.
From New Hampshire. I think the last 6 months, several things come through my mind. What was very impactful? The impactfulness came from me being open to learn other systems of medicine and learn what they have to offer. That's the one piece. And the lectures and the simple talks Hemant ji gave, Kishore Kumar gave, Dr. Halla gave, and probably sitting with Dr. Nagendra and then listening to his 1 hour of holistic presentation and sitting with Dr. Nagaratna, looking at her, how intelligently within 45 minutes, she could get every possible detailed psychosomatic history and also conflict history. It was amazing. That said, a simple exercise I did with a patient, I am administering transmagnetic stimulation for depression. Patient is getting better. Her problem is insomnia. Without me being shy about practicing Brahmari, without me not being shy about practicing left nostril breathing, the patient had a significant benefit. So dealing with people who has no concept of Hinduism, no concept of yoga, no concept of that, demystifying them and letting them know that this is an exercise you can do is amazing. And it's only a beginning. I think the difficult part for me is I used to envy Ayurveda when I was a young medical student. Now I feel that how come I did not learn that as a young student? That was my insight. And the other thing is, I don't have a clue about homeopathy. I don't have a clue about Unani. I don't have a clue. Oh my God, it's only a beginning. My anguish is that I'm not 30-year-old, I'm 74 now. How can I catch up with that? So these are my passionate feelings I went through. And the rest of the group who are participating here, you do not know how fortunate you are to enter into this field. and trying to help people who need. I think this is an excellent course. I think I had to humbly, I think it has been a very pleasant experience. I can't say anything more. Thank you.
Shantaram sir is a consultant psychiatrist practicing in the US, and he has been more like a faculty to us because his comments, his feedbacks were a learning experience for us also. So thank you so much, Shanta sir. We have Dr. Monica Patania. She is Associate Professor of Medicine in AIMS, Jodhpur. She participated in this course and she was our student in this course. So Madam has raised hand, although she is traveling to Jammu Kashmir. Madam, please.
Yes, good evening, respected sir, seniors. I'm Dr. Monica. I am at AIMS Rishikesh. And it has been a great fortune for me to be a part of this because as a practitioner of general medicine, I have seen that chronic diseases, we don't have the recipe. I mean, we can cure. So, and this course made things more clear, the vision, and I got the roadmap. How I used to think, how will we integrate this and how will we make people understand? Though I am doing and I am generating evidence little by little in my OPD, but how to go? But visiting SVASA, meeting Nagendra sir, and all the classes we had, even the Ayurveda, it opened a new lobe in my brain. So it was like, I think I got a roadmap how I will be going. And I, as Dr. Sir Gangadhar sir, we had discussed few times. And I think I will be very much interested to start the integrative medicine. I had prepared some baselines, but this course will help. I think I've met, I have now, I know I have people where to go when I have some doubts. So this has been a great learning experience. Dr. Hemant was very clear about what he wants to, make us to explore. Like it was like sparking new things, new ideas of what we can use, because most of the modern medicine people don't know about Ayurveda properly. All they know is through the media, not through the actual experts. So I think there is a need that modern medicine people, our PGs, our people also know how these principles work. So I am surely going to promote this, and how I can make similar things in medicine. I will look up to it. And I'm very thankful to all of you for giving me a chance for this great learning. Thank you. Thank you. Thanks so much.
Thank you, madam. From your busy schedule, you maintained 80% attendance in the course. So really, I am thankful to you and I congratulate you. So Diksha has just finished her MBBS. She is from the Sri Devraj URS Medical College, Kolar. Yes, Diksha.
Good evening. I'm Dr. Diksha Pandey. I've just finished my MBBS from Sri Devraj's Medical College, like sir told, 6 months back. The last 6 months have been a wonderful journey filled with immense learning experiences from different courses, different branches of medicine, which we had just heard about, or some of them which we were not even aware of. And not just learning about it, we learned how there is evidence-based practices which are available, and what is the best synergistic way we can apply all the medicines together for the welfare of the patient. I always wondered when I was doing MBBS that there are so many patients that we are not able to help, or we are just providing palliative care, which is not even that helpful. So how can we help the patient? So always there's a thought in the back of my mind. But this thought, it started forming its form after I have been to this course, because now I can see, okay, there is a path. There is the clarity in the picture is seen. So for all this, I'm really grateful to SVASA and NIMHANS for organizing such a course, which is having such an immense opportunities in the future. I would really like to thank all the teachers who have guided us, who have literally held our hands in between and guided us throughout the course, where we were not able to understand few things. Few things were a little difficult to understand. Just fresh out of MBBS, we don't have so much of clinical knowledge. Still, they took time and efforts for us to understand certain things, understand certain concepts again and again. Even the offline courses that we achieved, we interacted with so many teachers and so many senior residents who have taught us so much. So I'm really grateful for that. Saying all this, I do realize that there is a long road in front of us. We have just seen the tip of the iceberg, and there is a long journey. But I've heard that the smallest steps in the right direction can be the biggest steps of your life. So I hope this is one of them, which can lead to a journey which I have always thought at the back of my mind. Thinking about this now, I actually feel that an MD course should be there in integrative medicine, so that more doctors are aware of this and more patients can be treated holistically, and the diseases can be treated with the root cause, not just the symptomatology that we are practicing. Most of the doctors are practicing nowadays. So I really would like to thank you for giving me such an opportunity to be part of such a wonderful experience. Thank you.
Thank you. Thank you very much, Diksha. So we will take the last feedback from Shreyas, who has done his MBBS from Kolhapur. Yes, Shreyas.
Yes, good evening, everyone. I would like to tell how this integrative medicine changed my career completely. So I had just in May completed, given my NEET PG exam, and I was not interested in going in allopathy. I wanted to have some different perspective and knowledge. And at the same time, I was checking the NIMHANS website and the integrative medicine course came up. So I immediately applied for it. And in the June itself, I came for offline training. And during that time, when I saw the integrative medicine at NIMHANS and at SVASA, I was completely blown away, and I decided to do something in this itself. And Hemant sir encouraged me to pursue an MD at SVASA. So immediately in the next month, I appeared for SVASA's MD exam. And currently I'm pursuing MD yoga at SVASA. So everything happened one after another after I joined this course. And I'm really thankful to everyone, all the mentors, all the teachers who guided and taught us. Thanks a lot, sir.
Thank you, Shreyas, and all the very best. All the very best.
Thank you, sir.
So now we are towards the end of the program, and I request Professor of Ayurveda, Dr. Kishore Kumar, to kindly give the vote of thanks.
Thank you, Hemantji. It's been a wonderful experience for us too, with the people from various disciplines. We for the first time we were able to see professionals from MBBS, BAMS, BNYS on a common platform, and then evolve things that can be common to all, because throughout our education we have been not exposed to interdisciplinary exercise. So even for me too, it was a very beautiful learning experience. I had not heard such kind and loving words from various people about the science and the learning experience that you have had and we have had. It is actually overwhelming. So thank you so much for all your wonderful feedback. It is we were very apprehensive in the beginning as to what this integrative medicine can pull off, how it will be received, and are we in the right direction or so. This instills a lot of confidence and also encouragement and motivation for us to carry forward this endeavor in more robust ways as possible in future. So thanks for all this. At the outset, I would like to thank Honorable Guruji from SVASA, who has been a leading light as Dr. Gangadhar sir was saying, he's been in the forefront of integrative medicine since quite some time, since years. I was fortunate enough to listen to his first speech when he began his journey in this direction in the Institute of Science in the Tata Institute, where he addressed some of the students. and gave his vision of integrative medicine way back in 1993. So I was just second year BAMS student then. So thank you very much, Guruji, for having supported this endeavor throughout the country and leading the whole team. I would thank you. I would like to thank Pratima Madam, who has been standing behind us like a pillar and supporting us in all our endeavors, giving us wonderful feedback and also helping us to improve, and taking her time off this very busy schedule. She's been there throughout the session. Thank you so much for helping us and supporting us, ma'am. And coming to this valedictory session, it gives a lot of encouragement to us. I would like to thank Gangadhar sir, who has been our mentor. He's been a fatherly figure for the whole of the team at NIMHANS, and also in the field of integrative medicine. At every step, he's there to prod us into the right direction wherever we are going. Thank you very much, sir, for standing as a very strong pillar of support. Thank you so much. I would also like to thank Dr. Shivram, who's been with us as the head and leading the team. I would like to give a special thanks to Hemanji, who has been coordinating the course since the beginning. We were all a little nervous because this was the first batch. We had to plan the curriculum. We had to, say the right things. So, we're very happy that he led successfully the whole endeavor. I would like to also thank Dr. Nishita, Dr. Shivkumar, Dr. Umesh, who are part of this team, and also all the residents of the department. And last but not the least, all the participants who've been so consistent. They never lost. Initially we were also apprehensive. 6 months is a long course for a beginning, course for a course like this. And then, we have not seen the enthusiasm go down or interest come down. The students have been so receptive. They have been so encouraging to us, especially Dr. Shantaram, who has been a source of constant inspiration to us. Whenever we, I used to ask Hemanji, what is the feedback? How was the class? How did they receive it? Did they like it? Or they want any improvements? So it was very nice, sir. And also all the other, even Madam from AIMS, Shreyas, and all of you have been a very good source of inspiration also for us, and also learning experience for us. We hope to continue our contacts in future, and then collaborate in more such projects in taking forward this agenda throughout the country and also to the world. Thank you one and all for joining us in this moment. Thank you so much.
With this, we conclude the program. Thank you all of you. Chandru, do not end the meeting. Just let the because students will remain.
Can we have a Shanti mantra?
Guruji, yes, Guruji.
Sarve bhavantu sukhinah, sarve santu niramayah, sarve bhadrani pashyantu, ma kaschid dukkha bhag bhavet. Om Shanti Shanti Shanti. Thank you.
Thank you. I request students to remain in the meeting. We will have a 10-minute break and then we will join back. This meeting will remain on.